Good evening, Oklahomans. It's Dr. Noel Williams, Optimal Health Associates. We're going to review COVID-19 for March 24th, 2020. First, I want to say a big thanks to Jim Traber and his team for saying nice things about what I've been trying to do. I really appreciate everyone's support. I get lots of texts and emails and things, and that's really wonderful because not everyone is always in agreement with believing COVID's important. So thank you very much, and a big shout out to Jim Traber and his group. So thanks very much, Jim. I appreciate it. So let's go over things that occurred today and put them in perspective. As most people may have heard, or some of you may have heard, Governor Stitt did do a news conference today. He was in a suit instead of the emergency jacket he wore the other day, so he looked a little more prestigious, I thought. He announced that we're going to do some kind of shutdown of non-essential businesses. He wasn't very specific. There was no real plan defined, but be that as it may, he did say massage parlors are going to be closed, which I think is important for a lot of us, and I think hairdressing type or barbers and things like that. They'll give a definite list in the next day or two. Gyms are also going to be closed. So they'll let us know what they're actually planning. They kind of announced it without a plan, but I'm very happy they've done that. He also kind of basically said we need to shelter in place, especially if you're older or if you have risk factors. So again, the state's very, very trying to get to where it needs to be, and I think we're getting there, and I think there's a big thank you for a certain doctor in this town for helping communicate that to the governor and getting him to listen. And I know who it is, but I can't say, but at some point I'm going to praise someone pretty intently for his incredible work on getting the governor to finally start seeing what's going on here. The rest of the news conference was a little bit of not real meaningful. They're talking about the lab and getting the lab rollout done. I had my test last Tuesday, and one of the people that they put out said, "Oh, we're mostly caught up on tests." Well, my test isn't caught up because I still haven't gotten mine, and neither has several other people I know who were checked on that Tuesday. So in theory, I would come off my quarantine essentially tomorrow if I hadn't been tested, but that would be really stupid on my part because I do have this chronic little cough thing going on, and I need to see I want to get my test results before I would ever potentially expose everyone. So we're going to be behind on testing still for probably another several weeks. It is not so simple, again, as I mentioned last night, to start a new lab testing procedure for anything, let alone COVID-19, and roll it out and get it done. I have a family member who's in this business to get it rolled out at their large lab center, which is state of the art. It took 5 days of 27 people to get between the computer people and the lab. There's a lab interface system. It's very complex stuff, but hopefully we'll be able to get something moving in the realm of 50 to 100 tests at least a day at OSU and OU, which will be a big change from what we've been doing. So that's all positive. Our testing's coming along. The governor's getting the state ready and starting to move forward. So all real positive stuff. If we look at the national level, we're so far about 10,000 more cases today, but there's still a lot of reporting due. I'm doing this at about 5:30 right now this evening, so there's still a ton of time left. New York is turning into just a disaster. There's over 25,000 infected people there, and a great many of them are sick. Governor Cuomo has said they need up to 40,000 ventilators. There's only approximately 70 to 75,000 ventilators in the whole country, so that's a problem. So the doctors there are working very hard, doing their best, but there's a lot of sick people there, and we're going to start having a little higher deaths now starting occurring out of New York. California still has a lot of cases, and they're going to start getting a lot more cases. Denver and Louisiana, along with Texas, are all going to start becoming a little bit more hotbeds, and Chicago. So pretty much we can depend on about somewhere in the range of a 10 to 20,000 person a day increase in the United States, I think, for the next week. Then it will probably go up from there. Do not be surprised if we get banned from flying to other countries soon, because as the World Health Organization said, we're turning into the hotbed in the country in the world right now with the most cases per day, and yet we're not closed down. So it's just going to get worse. India, the second largest country in the world, had a case pulse today. Nothing anywhere on our scale. They've locked down the whole country for 3 weeks because they do not have any healthcare system, and if it goes through their country, it's going to be absolutely devastating. So that's the update for the day. We're kind of status quo. Everyone needs to be on their zinc. Everybody needs to be taking their multivitamin. You need to be staying away from people. And that's what you really have to do now. We're kind of in a status quo, and we need to keep our vigilance up and believe that we're going to get through this, which we will. It's going to start getting a little bit more difficult when the numbers change in the next week to week and a half and the death rate really starts to go up. But we're going to get through it. The Oklahoma City's hospitals are in fabulous shape, and thank you to everyone who donated things at Baptist. Baptist still needs tons of hand sanitizer and wipes, as does Mercy, OU, and St. Anthony's, but everyone's done such a great job with sewing N95 masks. They don't need any more at Baptist. That's great. So now we really want to reach out. If you know anyone in home health, any kind of home care, anyone working at a nursing home, they're the next group that needs masks. So if you live by a nursing home and you're someone who can stitch, make a few masks and bring them over, they'll be appreciative. And if you know anyone in the home health world, they also need masks now too. But great job, Oklahoma, for really stocking the hospitals up. And the other thing the governor did say is there's no elective surgery anymore or actual hospital-based procedures for at least the next 2 weeks. That's going to pad out our personal protective equipment a little bit better, which we need to do if this really heats up the way it might. So great job, Oklahomans. You all are really fantastic and hanging in there. Great job to all the medical people I know who are working absolutely hard as possible for our community, and the hospital administrators likewise who are throwing their full support behind the medical community. They're all doing great too. So I think the whole business medical side of our community has really come together, and it's amazing. So we should be happy. So I will give an update tomorrow. Take care and good night.